So why don't you go ahead and introduce yourself for me?
All right, my name is Jamel Barden, and I live in the SeaTac area, or actually in the Normandy Park residential area,
Okay.
and just west of the airport. And this is a long drive for me to come this far, but I've found over the past 9 years that I've been coming to see Dr. Craig Lapenski that he has helped me in many ways. He's helped me with my headaches and my neck aches and my back aches and just a little bit of everything.
Yeah.
And I keep thinking, oh, that's just too far to go. And then if I start feeling like I have some pain in that area, then I have to call Lori and make sure I have an appointment.
Yes.
So I just dearly love him in a professional way, that he is very thorough, and I think he really checks me over completely.
Yeah.
And it's hard for me to believe it's been 9 years
Wow.
that I've been coming
Wow.
from where I live in Normandy Park to Graham, Washington. I didn't even know what Graham existed until, but I have a friend by the name of Claudia Branham,
Okay.
who I dearly love and have so much respect for. She told me that I should try and see what he could do for me.
Okay.
And so I know that it has something to do with your brain and the axle in your neck, and that they have to be in alignment to function properly. And so, everybody needs brain help.
Yes, they do. Yes. So, do you remember your first adjustment? What kind of initial
Gosh,
feeling was that?
I remember that I laid down on the table, first of all, just to find out if my legs were straight.
Right.
And they were at least, I was at least a half an inch off or more.
Wow.
I don't remember exactly how much it is, but I'm sure that he's got it in his records and so on. And then they put you on this machine where you just stand there and you back up, and they just see if your hips are in alignment, and they see whether or not you might be leaning a little bit to the right or a little bit to the left with this machine, and he tells you whether you're off or whether you're not. So most of the time I don't need an adjustment, but it's good to find out whether I do or not.
Yes.
So I've enjoyed him immensely. I just do have a lot of respect for him as well, and
Wonderful.
so that helps me to be more encouraged to come.
Yes. So, how has this helped your quality of life?
Well, I think that helps with everything, because you need to have whatever you can, and your brain working properly. But I mean, I am 85 years old, so I'm not a young chicken anymore, and I wish I had come earlier, because
Yes.
then he could have possibly helped these things. And I was very active at high school, at Highline High School, and I graduated from the University of Washington, and I was a cheerleader for 6 years out of that. So I think that I fell and took some
Yes.
took some spills, that I was trying to learn how to do different things.
Yes.
And so there were just a lot of reasons for me to be here.
Yeah.
And I just came to an orientation meeting on a Tuesday night too, and I think those are excellent, because he actually explains to people why they should come and see him if they have any headaches or stomach aches or back aches or shoulder pain or whatever.
Yes.
So I just appreciate that he's here, and I appreciate that out of like 250 or more NUCCA doctors in the country, that he's one of the few that's board certified.
Yes.
And so I think that that's great.
Yes, absolutely.
So
So if you had a friend that was thinking about coming in, what would you tell them?
Well, I've talked to several people. And right now I'm talking to my sister-in-law, who has said she's had neck problems, and so I'm getting a DVD from Lori today and a brochure, and I'll share that with her because.
So this is something you enjoy sharing with other people because it's helped you.
Yes, absolutely.
Wonderful. Well, thank you so much for sharing your story.
You're welcome. I don't know what else to tell you except it's been, when I was here last time and I actually got an adjustment, I felt so much better when I was going home, and when I stayed and rested in the recuperating room, I guess it's called, I could just tell an immense difference.
Wow.
It was really nice.
Wow. Well, that is so wonderful. We're so glad you've been coming in, and we'll be excited to see you again soon.
Thank you.
Great.
Thank you so much.
Thank you.